I use the system primarily as a clinical tool to help me comprehensively evaluate specific walking patterns of the foot and ankle, hip, and lower extremity. What I first do is I take a really good clinical history of the patient, a thorough examination in my office, and then we usually set up a date and time at our Plano Therapy Center to go ahead and evaluate with the F-scan. You know, I just go ahead and record what I'm seeing. Then we kind of have the patient back off, shut the treadmill down. I'll evaluate the data real quick, make sure everything looks good. And then at this point in time, we could either switch shoe gear, I could alter the insole that's in there. I could test other insoles that they've either had or my own insoles. And this way we get a really good comprehensive evaluation of what's going on as far as their biomechanics. I get a clear understanding of their walking patterns. And then I formulate a treatment plan, which is very specific. I go over the F-scan entirely with the patient, and with this treatment plan, you know, I have them come back to the clinic. Either we cast for orthotics, we assign physical therapy, bracing, any other modality that I think that would be necessary to help the patient. You can always follow up with another F-scan after your treatment application is completed. You know, orthotics, physical therapy, or just a follow-up after 6 months. You know, or again, if they're still having pain, you know, whatever the situation is, the application of F-scan is unlimited. I mean, you could design your practice primarily around either surgery, biomechanics, you know, general podiatry, whatever it is. I mean, the clinical application combined with this right here is very unique. You can see certain things biomechanically that all podiatrists have been taught. You know, their head's going to do something, their shoulders, their hips, their lower extremity and feet. But with this application, you can you have a degree of certainty of exactly what their mechanics are doing. I mean, like I said, you use a movie, so I can understand watching this movie, and I look at each phase of gait and what's happening at any given time to establish, okay, this is what's happening this part, this is what's happening this part, and this is what's happening this part. And the patients appreciate that you can explain it to them in a really simplistic way. It's like a tool that I have. It's like, you know, everybody's got a hammer, everybody's got a screwdriver. I have a toolbox that I believe is very applicable. And, you know, some people use x-rays, MRIs, you know, all these modalities to determine, you know, what's going on with whatever pathology. This is a great tool to use. It's specifically a tool. It doesn't, you can't just do an F-scan and you spits out this piece of paper and says, oh, they've got this to this. That's why it's very important to understand the application of how the F-scan works and have pretty good understanding of biomechanics and foot function. And as you just put it together, it works very good as a tool to do whatever you want to do.